What is ESWT?
But ESWT, actually known as low intensity ESWT, is extracorporeal shockwave therapy device, mostly popular for the last 2 or 3 years in all over the world, and has some universal approvals for this objective. It's a device that causes treatment for especially vasculogenic erectile dysfunction patients.
Who are the candidates for this treatment?
As we know by now, the most common candidates are those with erectile dysfunction, and these are demonstrated by their low international index for erectile function scores, and also those people having a low vascular flow, that means disturbance in the hemodynamics of the penile system, and those patients with erectile dysfunctions who are not responding to some drugs, some medications, and for the last years, those patients with post-prostatectomy, especially for prostate cancer surgery, we use this device for rehabilitation of the erectile system in those patients. And of course, some chronic diseases such as diabetes or chronic kidney, in which we have some problems with the penile system.
Is the technical specifications of the device play a role in the success of the treatment? And what is the advantage of Modus ED device over other devices?
Yes, certainly. ESWT devices are separated in 2 categories all over the world. They are either focused or radial devices. For the purpose of erectile dysfunction treatment, we have to use some focused devices, because by now the literature shows us that the focused devices are more successful in treating such patients. So the device should be focused, and also the device should have a display on which we can adjust the frequency or the amplitude of the shock waves. In this means Modus ED device that I have been using for about two or more years myself has some certain advantages over other devices for having this display and the adjustment and the focus properties.
What are the physiological effects of ESWT on penile tissue? How is the therapeutic effect achieved?
There are still a lot of investigations going on in this area, but by now we have some data, some significant data about the physiological effects of ESWT. We can say, for example, this shock wave makes an inflammatory reaction that heals the tissue. Also, there is an important data about nitric oxide synthesis. This nitric oxide is a biochemical substance that we can have it in the corpus cavernosus of the penis, and the shock wave increases nitric oxide synthesis, and also vascular growth factor. Or endothelial vascular growth factor. This is another biological component, and it increases the angiogenesis. What I mean is, it causes, it produces new vessels in this corpus cavernosus, in the penis. So these are the anti-inflammatory or angiogenetic effects. Maybe talked about. We can talk about these effects as physiological effects that we know by now. But I'm sure that we will, by the investigations, we will reach many other factors that heal erectile function.
Can we increase the therapeutic effect with additional medications? Is the effect temporary or permanent?
Certainly we can, by using some drugs that we call phosphodiesterase type 5 inhibitors, that they are very commonly used for about 20 years in the world. These drugs, as we know, increases the corpus cavernosum smooth muscle relaxation and also the blood flow. So if we combine these drugs with ESWT, certainly we will achieve better results, and the literature shows us that better results are achieved when these drugs are combined to ESWT.
Is there any side effects or complications? Is there any group of patients for which ESWT should be avoided?
Well, I can say there is no certain side effects, and the application does not cause any pain at all. So we can apply this for all patients. Maybe a little numbness or a little pain, a little itching, maybe a little hyperemia, local hyperemia. These are all transient actions that won't last more than a couple of hours. So there is no contraindication about this treatment. But maybe I myself trying to be careful on the patients using anticoagulant treatment, because as we know, those patients can bleed readily. So we can maybe be a little bit more careful about these patients, and that's all.
How long does the treatment last? What is the method, and can the patient continue with his daily activity following a session?
The method, the application lasts about 10 or 20 minutes. It depends on the number of shock waves that you apply to the patient. Approximately 1500 shock waves are applied to the patient, so approximately 15 minutes is enough. Of course, the patient can go on walking after the treatment without any limitations. Number of sessions depends. Literature, according to the literature, we know that about 6 or 10 sessions are required, but it really depends on what is the reaction of the patient, or what you achieve with the treatment. The important fact is here that you have to control the blood flow of the patient after each session, so that you should be clear about that you're on the direct or correct way or not.
Is there a need for maintenance treatment? How do you follow up the patients?
Yes, this is another good question, because according to the recent literature, maintenance treatment is also advised. Let's say about 1 month later or 2 months later, once in a month or once in 3 months, and maintenance treatment will cause the beneficial effects of the treatment last longer.